Hello, in this video, we're going to go over infections caused by the bacteria found in the Staphylococcus genus and the Streptococcus genus. So let's start with Staph aureus. So Staph aureus is a species in the Staphylococcus genus. Um, Not to be confused, by the way, with Staphylococcus epidermidis, which is commonly found in the skin. Staph aureus is going to be commonly found in some individuals in their skin and nasal passages, but it can also cause infections. One of the main infections it causes is skin infections. Folliculitis, furuncles, and scalded skin syndrome are just some of them. And so this bacteria, if it is able to get into the skin, whether you have a cut or whatever, the bacteria can cause tons of different types of infections. This, by the way, is scalded skin syndrome, where your skin starts to peel from the infection. Staph aureus, by the way, is famous for being the mannitol salt agar positive organism, positive for mannitol fermentation and positive for salt tolerance. It can also cause food poisoning. So, if you eat food that's contaminated with Staph aureus, you can get food poisoning, which obviously has its own set of symptoms. And then secondary to that, you can get toxic shock syndrome. So some strains of Staph aureus produce toxins that if it gets into your bloodstream, then you go into toxic shock. Um, and your blood pressure drops and everything. This, by the way, is a secondary part of the infection, and you can get it from being infected with either, for example, if you had scalded skin syndrome and the bacteria produce toxins, which then goes into your bloodstream, then you would also get toxic shock, right? Or if you had food poisoning with Staph aureus and it also produced toxins, then you would then get toxic shock syndrome. So this is kind of like a secondary symptom that you would get. Anyway, and then there's, of course, MRSA, which is an issue right now in the healthcare setting. MRSA is methicillin resistant Staph aureus. It's a growing problem. And yeah. All right, moving on to Streptococcus pyogenes. So this is a Streptococcus. So it is in a, line. The bacteria are cocci circular and they're in a line. And Strep pyo also has a ton of different types of skin infections that it causes. Actually, this table right here summarizes all of them. And so cellulitis, is just localized inflammation, usually when the Strep pyo gets in through a cut. There's necrotizing fasciitis. This one is if the bacteria gets in again through the cut, but it's going to start basically eating your skin. So we call this, classically, it's called the flesh-eating bacteria, because your skin tissue starts to die, and of course, you could die from shock or death as well. And then, of course, famously, Streptococcus pyogenes is known for causing strep throat. So not only does it cause all of these, it also causes strep throat. So just depending on how it enters your body, if it enters through the skin, it'll do one of these. If it enters through the respiratory tract, it's going to cause strep throat, also known as pharyngitis, which gives you the classic fever, sore throat, etc. Now, if the strep throat becomes progressively worse, the bacteria can produce toxins, which can spread into the bloodstream and cause scarlet fever. So scarlet fever then includes, that the classic scarlet fever rash, petechiae, so all these like red rashes all over the body. And so, of course, all of these are going to be treated with antibiotics. Yeah, so that's strep pyogenes. And then finally, strep pneumoniae. So it's also a streptococcus. So it's a cocci that's in, lines, strep. And this one causes a ton of different diseases as well. So respiratory infections, it can cause, the classic ear infection, also known as acute otitis media. It can cause pneumonia. So it's called pneumococcal pneumonia because it's specifically pneumonia caused by streptococcus. And, this is going to be mainly for individuals who are immunocompromised or are just vulnerable due to age. So this strep pneumo is found in the lungs normally and it just hangs out. But if you are immunocompromised or whatever, or you have the flu, for example, then your immune system is down. And so then strep pneumoniae can cause pneumonia. which obviously gives you that, extreme cough, sometimes bloody cough, fever, etc. So, okay, and then strep pneumo can also cause an infection in the nervous system. So that's called pneumococcal meningitis. Again, this is typically in individuals who are vulnerable, whether it's due to age, immunocompromise, etc. But anyway, the bacteria can travel through the blood-brain barrier and infect your meninges, which are the layers that surround your brain and spinal cord. And again, the meningitis could be due to exposure when you had pneumonia and then it traveled. So, there's different ways for it to get into the body. But yeah, so that is strep pneumo. And again, there's different antibiotics that we can give. There's even a vaccine for the one that causes pneumonia and the one that causes meningitis. Um, so yeah, that's all I have for this video. Thanks for watching, and I'll see you in the next video.